Well, the SOE as a congress has always been a multidisciplinary congress, as opposed to many congresses which are more specific for one subspecialty. So what we try to do in these congresses is, we have the congress once every 2 years, is try to educate people in all the subspecialties. So we bring under one roof, we bring all the subspecialty societies so that we can give the latest developments in each subspecialty. The highlights for me for this year's Congress are the great improvement that we've had in the young ophthalmologists we introduced wet labs a couple of congresses ago. Our first wet lab congress was in Copenhagen, but since then we've moved forward. We've noticed the keenness of the residents to do wet labs, so now we also have a dry lab in the young ophthalmologist lounge. Apart from that, I think the highlights have been the keynote speakers. We've had 4 excellent keynote speakers. And what other things that I've noticed very useful have been the new educational lectures and symposia being given by certain subspecialties. One that which I went to yesterday myself just to see how it was doing, is the update on keratoconus and corneal topography, which a lot of the junior and trainee ophthalmologists attended. It was a full house, and I think the reason behind that was they were introducing these new formulas for corneal topography for use on the pentacam scan, which obviously made the junior ophthalmologists very keen to attend. So the highlights to me are the updates, the keynote speakers, and also the interest and the new wet and dry labs for the young ophthalmologists. Within VR surgery, vitreoretinal surgery, I expect more and more equipment to come on board, but more than from the surgical point of view, it's from the medical retina point of view. As we all know, a lot of companies are now investing a lot of money in developing new anti-VEGF, anti-vascular endothelial growth factors, and I expect over the next couple of years, there are a lot of clinical trials going on at the moment on a lot of new products which are on the horizon, and I expect within the next couple of years some of these will come online. And once they do, one of the major developments would be a decrease in the number or the frequency of injections that we have to give to patients, because that is very cumbersome both on the ophthalmologist and on the patient. So I expect within the next couple of years, this I think is one of the major developments in ophthalmology. It has been for the last few years, and I think it will continue to be for the next few years.